Howdy everyone, Matt here. I got a question for you. Are we as physical therapists truly practicing with autonomy? Or maybe not because people are telling us what to do? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic of something for the physical therapy world. But first off, thank you to everyone who has subscribed to the channel. Thank you so much. If you enjoy the content, hit that subscribe button. And of course, if you like the video, hit that thumbs up right down there below, right there. But getting in on talking about this, practicing with autonomy, meaning that we can do what we feel is best for patients. You know, that was part of Vision 2020. Yes, people have their opinions about Vision 2020, but guess what? It's in the past. Move on. Okay. I've already talked about that. If you want to change it, get your DeLorean and go and change it. But practicing with that autonomy, doing what is best for our patients. And I think there is a part of that we are not really looking at because, you know, we have direct access. So patients could, hey, come right in off the street. Your shoulder hurts, your back hurts. I'm dizzy. I'm having trouble holding my urine. You know, someone had a brain injury or stroke. I can go and be seen and be treated. But like I said, there's this thing that's still lingering around that's not being addressed. And that is when referring providers, so mainly like physicians, are writing on orders and telling us what to do in therapy. Now, don't take this out of context. There are times when that is important. So take someone that has a surgery. So if somebody undergoes a surgery, I would like to know their protocol of knowing what to do and when. Perfectly fine with doing that because that's what that surgeon does. They go through the training and the understanding of that surgical intervention. They know what they did. They know the quality of the tissue because they saw it firsthand and saying, hey, you know, just don't stress this, don't do this, and don't do that. Perfectly fine with that. But take it and look at this. How often do you get a prescription? And we're just talking about that, with that prescription in which there's a list of exercises and modalities and the frequency and duration that we should be doing with a patient. How often do you get that? I legitimately last week had somebody that came to me with a very mild knee pain, very, very mild knee pain. Really, it just from an overuse. They had been running. They ran 2 marathons in less than 4 weeks because they had signed up for them. A very mild irritation to the patellar tendon. There were 2 pages of exercises that they wanted this person to do and that they wanted me to instruct them in doing. And I'm not saying it was anything just spectacular. It was so basic of exercises. And you can tell a lot of this stuff was based upon, you know, things that we were told years and years and years ago for like a patellofemoral disorder. You know, have them do long arc quads, but only go from 90 to 35 degrees. And don't do this and do some wall sits and do this and do that. And it's like, did you actually evaluate this patient thoroughly enough to say that these exercises are what they actually needed? It's like, that's really the thing that I see with this. Whenever I see those exercises just listed on there, like the specifics of it, it's like, again, did you thoroughly examine them and assess them and move them and test their, you know, their strength, their range of motion to say that those are what they actually needed? Or does it just say, oh, well, there's this diagnosis I came up with and these exercises treat that diagnosis, so just do these. For what reason? Because ultimately, we'll put this simply. That is what I do. That is what I went to school for. That is what I learned in school. That's where all the continuing education that I do, that's where all my knowledge and experience is in understanding how to implement those things with patients, to know exactly what to do with them, what exercises to load up tissue, to strengthen tissue, to improve mobility, to improve function. That is what I do. I know what to do. And I'm going to say the people that want to say, oh, well, maybe they get, no, so often, so often, and probably 99.999% of the time, the exercises that are put on there are the most basic of the basic. It's nothing groundbreaking, nothing very specific. It's very, very basic exercises that are written on there that we as therapists know much more advanced, much more effective, much more current ones to be doing. That even goes over to modalities, okay? We don't need instructions in what modalities to do with people. I'll see you put in there cold, heat, electrical stim, traction, ultrasound. We don't need instruction in what to do with those. We don't. We know. We know exactly if a modality is going to be effective, or with very often modalities, shown them not to be like extremely over the top, like beneficial for like helping a lot of things. And I tell patients that this heat or ice feel good, electrical stimulation feels good. I'm a fan of them, but you're going to get much more from moving and exercising, doing stuff like that. Now, maybe if you're in a very highly irritable state, doing something like heat or ice or electrical stimulation or something like that to calm things down. I said, now, if we can utilize, and I talked about that in the past, if we can utilize those things to maybe calm down something to get movement going on and get much bigger bang for our buck with the movement, we can utilize those. But we're not just going to sit, oh, okay, yeah, you get done with your therapy, we're going to slap the heat and ice. Again, we don't need instruction in saying what modalities need to be used. And I'll be honest, often the times when they're put on there, there's stuff that we don't even use. Like, you talk to clinics, they don't even have like ultrasound machines or e-stim. They just got rid of them. So we don't even need, we don't need that. There's another kind of part that goes into that. And I would ask any physician, nurse practitioner, any provider like that who sends to physical therapy to also please not tell patients that, oh, this is what they're going to do in physical therapy with specifics, saying, oh, they're going to do some ultrasound for you. They're going to do some dry needling. They're going to do some shock wave. Oh, they're going to stretch you. They're going to massage you. They're going to, give you some light exercises. To please not do those things, because patients who go to you have a lot of trust in what you are saying. They're saying, okay, that you are going to do what is best for them. And granted, yes, there's some people that would argue, they say, no, they just do whatever. We're not talking about them. But when a patient is told those things, it sets that expectation in their mind. So they are going to come into us expecting to get that. So the doctor told me you're going to massage me and put me on a hot pack. And when they don't get that, their expectation is not met. It may be that we do the proper thing that is shown of what they need, but because that expectation was set already by someone else that they have a whole lot of trust in, now it's like, okay, well, now you're not following what they're doing. You're doing the wrong thing because you're not listening to the doctor who sent me here. You're not listening to them. So you were doing the wrong thing. That can just set us up and put us into a hard spot to explain to someone. Granted, yes, they may have told you that we were going to do that, but that is not actually what you need. Maybe that information is old. Maybe that information is outdated. To please not do that. That also can put a negative thing into their mind. Now, I dry needle. I don't do it to everybody. I don't do it very often. Okay. It is something super selective that it's only for certain people who have certain conditions. And that really comes down to the evaluating and assessment of someone to understand, are they going to possibly benefit from that? But I've had where I've told providers, hey, I do dry needling. And they're like, oh, well, Matt will dry needle you. People are scared of needles. And that has immediately turned people off because they think, without ever talking to me, oh, well, he's going to stick needles in me. I ain't going to do that. So now we've lost somebody. Somebody decided to not go into therapy, to not get treatment because they thought we were going to do something that they don't want. I don't want to be stabbed. I don't want those needles. We may or may not have done it. I don't force it on patients when they come in. It's like, yes, and I've had patients in the past who have said, well, the doc said you're going to do some dry needling. And I said, let's evaluate and see what we got going on. And they may or may not be someone who has it. And maybe if they are, I'll bring it up and they've said, no, I don't want to do that. Perfectly fine. If you don't want to do it, it is your choice. We are not going to force something on you. Now, like I said earlier, that kind of setting things up, I've had patients that said, well, the doctor said you're going to do needling on me, but they've had like a stiff joint, a joint that the capsule's super tight. And it's like, well, no, you're not going to benefit from them. And they get all upset. And then the doctor gets all upset. It's like, no, you didn't do the right thing with them. No, don't set us up with those things as what to that this doesn't work out. And also kind of going with that, I would also ask to please not overstep into what we do. I've had that happen a number of times. I've had somebody with back pain. I'll use this example. I had somebody with back pain. I'm getting them moving. Flexion activities were aggravating to them. But, I had them go work on extension or strengthening. They go back and see the doc, and the doc was like, oh, yeah, well, I had them just start doing range of motion in all directions because I've had some good, things in the past. What do you think I'm doing? You don't think all the time and effort I spent with them, you don't think I understand when they would be appropriate to go back and do that? And the doc was kind of upset. I brought him and said, no, you don't think that I understand when to do that? You don't think that doing that can offset them? Did you actually listen to them in the things that aggravate and make their symptoms worse? And you're going to have them sit there and go into those things? Now, granted, yes, it is important to restore mobility and do that stuff, but this person was not at that point yet. So coming in on top of it to say, oh, well, I want you to start doing this too. Because you know what that does? Now you've drove a wedge between us and the patient. Now all of a sudden the patient can start thinking, well, maybe the therapist wasn't doing what was best for me. That the doctor had to come in and tell them to do this. Why didn't they tell me? So now we don't look like we're looking out what's best for them. You're overstepping into it. And again, you mess up that therapeutic alliance that we have going on with the patient there. So that's just another thing. And there's a thing on the bottom of that prescription that I want to talk about as well. That's the frequency and duration. For me, and let me know how you think about this as well, I don't believe that the provider should put any kind of frequency or duration in there. I honestly don't believe that they should, because that should be a decision between the patient and the therapist, because we are going to talk with them and assess so many things to understand fully on how often they should be coming in. Okay. Now, a couple examples. Okay. I've had patients that said, well, the doctor wants me to come 2 or 3 times a week. And this person is super active. They're going to the gym all the time. They just have a very mild pain. And I've had that with this, well, the doctor wants to come 3 times a week. You don't need to come 3 times a week. If we evaluate to say, hey, there's stuff that you can do in the gym because I don't have all the equipment that you have in the gym. You were doing a lot. Hey, I want you to do these things. Check in with me. I've used that with many patients that have said, oh, yeah, just, that's what I want you to do. Just check in. You are going back and living your life and doing those things, and I trust you, and you're going to communicate with me. I've also had people that had other things outside of it. I mean, one big thing, copays. We as therapists are considered a specialist in the eyes of insurance companies. So if somebody has a very high copay, so again, $30, $40, $50, and the doc's telling them, you need to come 3 times a week, $150. Now, granted, therapy is very important. Therapy can do a lot of great things. It's very important. But you're going to tell somebody to pay $150 3 times a week? They may really question that. That's a lot of money. What about taking time off of work? I got to take off an extra hour and get here. So I got to take off an hour earlier for work or more, come here and do the therapy. That's 3 hours a week I have to cut. That's 3 hours of work, of time and money that I've lost. What about like outside things, like family? Oh, I got to watch my kids. I got to do this. I got to do that. They have other things going on. And granted, yes, again, therapy is super important. It's a very important part of life, but people are going to put other things over it. But understanding, okay, hey, understand you have a high copay. You can't take that time off of work. You're whatever that you got going. Can you do once a week, once every other week? Email, communicate. Let me and you as the patient work on that and come to the decision of what needs to be for that. Also, again, the length of time. Everyone recovers differently. That's the big, that's the big joke. Well, how long is this going to take? Well, it depends. We don't know. We don't know the exact day, time, and hour and all that something's going to happen. Let that be a discussion between us, because somebody may get better in 4 weeks and they're saying, well, I still got to come for 2 weeks. No. Or somebody's going to think, oh my gosh, 6 weeks. I got to do all this. They may not, again, and all this being, they may never even come in because they're like, well, 3 times a week for 6 weeks, I can't afford to do all that. I ain't even want to answer the phone. I ain't even going to do all of that. And likewise, I've had physicians send patients for such short periods of time that nothing changes because there hasn't been enough of a time for a physiologic change. Good example, I had some docs sending me some elderly people with back pain who have been super inactive for years, who had just been super inactive, who are incredibly stiff, who don't move, who don't exercise. And they're like, okay, help their back pain. Okay, and you give me 3 weeks, 2 times 3. I'll never forget that, 2 times 3. And it's like, what do you want me to, in 6 visits over 3 weeks of trying to get this person to move and exercise and get comfortable with doing, just doing things, that takes some time to get on a steady routine and you can make progress in 3 weeks. But also, again, they're going to still have pain. They're still going to have limitations in movement because of their age and inactivity level. And I've seen them where they go back and they're like, oh, well, you're not better. Okay, well, that didn't work. No, what part of physiology did you forget that it takes time for tissue to change, okay? It takes time for tissue to change, okay? If you do the surgery on it, if you do a back surgery, are you going to be like, nope, next day, nope, you can find everything should be fixed. No, things can take time. And we start putting these limitations, we start putting that stuff in there. No. Likewise, for continuing with therapy, that's something also should be a decision between the therapist and the patient. The referring provider, I'm going to say, should not have a big voice in that, because I cannot tell you the number of surgical patients or people who are going through something that are so scared to go back. Well, I don't. What if the doctor tells me not to come back? And I tell them, no, that is your decision. Biggest complaints of people with knee replacements that they say when they get released from therapy by their surgeon is they aren't walking as fast as their peers and they can't do stairs like their peers. I can't tell you the number of knee replacement patients I've had over the years that are saying, well, I still can't do this. I still can't do that. And the doctor said, well, I'm done. I said, no, it is your decision. They still have a limitation in their life. And I will be honest, patients are many times not always forthcoming to say everything that they still have got going on. I can't tell you, my grandmother is a good example. She will say all this stuff to us in private. She gets in there in front of the doctor, quiet as a church mouse, just doesn't say nothing. It's like, wait a minute, where's all this stuff that you were going to tell them? What's all this stuff that you were going to say you're going to do? And nothing came out. Okay? I'm just saying, that should be a decision for there. And this very last thing. We don't need to be told to give them a home exercise program. I don't know why that is even on there. Like, I still feel instruct at home. Oh my gosh. I was going to completely forget unless I read that article. I mean, unless I read that on the prescription. So I'm not bashing physicians or nurse practitioners or any of this. I'm not. I just want y'all to understand. We know how to do our job. We know when somebody needs to do stretching or mobility. We know what strengthening they need to do. We know what modalities to use with them. We understand. We will talk to them to set them up for the frequency and duration that will work with them. We will understand if they can do more and they need to do more. Yes, we're going to get them in. But if they can't, we are going to work with. We are going to do those things with the patient. We are going to treat them. We don't need instruction from it. Because I will say, I've worked for companies that want to bend over backwards for whoever the referring person is to tell them, you do exactly what is on there. And I'm like, it's not even indicated. This stuff is so outdated. It is unbelievable. And likewise, telling patients, please don't tell patients, this is how long you're going to do therapy. These are the things that I'm going to do with them. No, we don't do that to y'all. We don't say, yeah, we're going to go back to your doctor and they're going to do this, this, this. Y'all would be furious if we did that. Do you do that to other physicians as well? Yeah, you're going to go see Dr. So-and-so and he's going to do X, Y, Z. You're going to go see Dr. So-and-so and she's going to do X, Y, Z. Do you do that? Would you do that if another physician wrote over? Now, granted, yes, there are specific tests and things that do like that, but if that test isn't indicated, are you going to go, well, they told me to do it, so I'm going to go ahead and do it? No. And also, we're going to give them a home exercise program. Don't worry about it. We will give them one. But anyway, let me know your thoughts, opinions, and beliefs down in the comments. Do you think we need to cross this one off to say, hey, let's look, to be fully autonomous, we need to handle that. We need to say, nope, yep, we can handle it. We know what to do. You don't need to put anything on there. We need to make a push. Say, hey, we're going to take care of them. We don't need y'all to say anything on there. Please don't overstep into our treatment plans and stuff like that. If there are certain indications that you would like this because you did an intervention or you did something, let us know. Communicate that with us as a colleague, okay? We can handle it, and we'll give them the home exercise program as well. Anyway, let me know those thoughts down below. If you enjoyed the video, hit that thumbs up button, and of course, subscribe to the channel. Doesn't cost you a copay. And until next time, take care of yourself. Take care of your patients. I'll see you then.